Welcome to today's discussion. I am Joe Giron of Chart Healthcare Academy. Today we will discuss and preview the EP Professional Continuum, a collaboration of efforts by CCI and IBHRE to provide a focused guide of information for EP professionals. Whether you are new to clinical electrophysiology or an experienced practitioner, you will find information that speaks to the EP workforce, credentialing, pathway continuum, and professional resources for advancement. As healthcare providers, we have a shared mission to improve the health and well-being of patients continuously. It is important to link arms to advance professional excellence through credentialing and competency validation. For clinical providers and industry professionals, credentialing demonstrates the highest level of professional excellence to peers, physicians, organizations, and patients. In an extremely dynamic industry, it is critical to advance evidence-based practices and patient-oriented outcomes with our collective scopes of practice. Professional competency is validated by credentialing and demonstrated by delivering excellent patient care. In specialty areas such as cardiac electrophysiology, or EP, technical and clinical concepts are merged. Professionals striving towards excellence need standards to challenge them as they learn. These come from credentialing exam standards. As a clinical provider or industry professional, credentialing demonstrates the highest level of professional excellence to peers, physicians, organizations, and patients. So, who provides credentialing and certification in the cardiac electrophysiology space? Well, there are two organizations. One, Cardiovascular Credentialing International, referred to as CCI, and the International Board of Heart Rhythm Examiners, referred to as IBHRE. CCI administers credentialing examinations to cardiovascular professionals, including nurses, allied professionals, educators, and industry professionals. Globally, CCI credentialing programs recognize several cardiovascular specialties. Amongst CCI's credentialing offerings, the Registered Cardiac Electrophysiology Specialist, or RCES, credential is specifically for professionals working in cardiac electrophysiology. Since 1985, the IBHRE has been providing competency certification in cardiac rhythm device therapy in cardiac electrophysiology. IBHRE offers various certifications to allied professionals, industry professionals, and physicians around the globe. They maintain the highest standards for cardiac rhythm management in electrophysiology and are recognized worldwide as the global gold standard. In healthcare, institutions and professionals are continually adapting methods and techniques to push the standards of healthcare to their highest potential and define them as best practices. These best practices pave the way to better patient outcomes, stronger margins, and ultimately healthier communities. Medical societies and organizations advocate for initiatives and guidelines to promote excellent patient care, facilitating advanced credentialing and improved outcomes. Trusted national and international societies such as the American Society of Cardiology, or ACC, or the Heart Rhythm Society, referred to as HRS, or the International Accreditation Commission, referred to as IAC, have each made statements regarding the importance of credentialing in the EP industry within as many years. So, what's pushing the need for professional competency? Well, explosive industry growth in cardiac EP procedures has increased the demand for improved technology and well-trained staff to offer worldwide access to arrhythmia treatments. Increasingly complex procedures and advanced technology have led to higher performance expectations requiring highly trained and skilled personnel. Together, CCI and IBHRE recognize the value of demonstrating up-to-date credentialing in the cardiovascular profession. This collaboration has led to the establishment of the EP Professional Continuum, a resource document that outlines the pathway for EP professionals to achieve the highest credentialing levels. The EP Professional Continuum highlights the various segments, including the EP workforce, information on CCI and IBHRE, resources for EP professionals, and a cardiac EP Advanced Continuum pathway. This professional continuum provides you with a roadmap for professional growth and career advancement by 1. Recognizing your qualifications for practice in your specialty area. 2. Helping you meet requirements for clinical and/or industry employment. And 3. Validates your knowledge and competence to employers, patients, and physicians. What does the career path look like for someone new to the field or looking to get credentialed? Whether you are a clinical staff, an advanced practice provider, or an industry professional, focus on your training, EP fundamentals, skills, and knowledge base. The RCES credential is considered the standard and the first credential in your professional continuum, followed by the CEPS or the CCDS offered by IBHRE. The RCES credential offered by CCI is considered the standard credential to validate intermediate levels of competency in EP skills and knowledge base regarding the professional continuum. The next level on the continuum is the CEPS or CCDS certification offered by IBHRE to validate your level of EP or device management skills and knowledge base. Using the continuum as a map, you can advance your career to the next level by leveraging your RCES credential to earn an IBHRE certification. The EP Professional Continuum enhances growth in a multitude of areas. One, by career advancement opportunities. Next, by meeting the requirements for clinical and/or industry employment. And thirdly, recognizing an individual's fundamental knowledge and competence. Lastly, followed by the ability to validate knowledge and competence to employers, patients, and physicians. Credential holders in EP or device benefit from several positions and growth opportunities in the EP and device field, including clinical staff, educators, industry representatives, and business development professionals. Review the work environment and occupational benefit descriptions under the EP Workforce section of the EP Professional Continuum document for more information on EP and device credential holders' career experiences. There are a variety of ways to meet the criteria requirements for the RCES exam. The RCES 1 requirement is an ideal criteria pathway for current staff or industry professionals. The RCES 235, RCES 4, and RCES 5 are for students and graduates of various educational backgrounds and experiences. Please visit the Qualification Requirements tab of the RCES credential on the CCI online website for more information. The RCES exam is computer-based and priced at $365 and offered year-round at Pearson Professional Centers. The exam consists of 170 questions consisting of various question types, including multiple choice, multiple response, innovative hotspots, and drag and place items. These examples simply highlight as examples of question types and format you will see on any CCI exam. Multiple choice are questions where only one of 4 possible answers is correct. Multiple response is where 2 or 3 answers are correct from a list of 4 to 6 possible answers. Hotspot questions require the test taker to click on one specific area of an image and answer the question. Drag and drop questions instruct the test taker to drag a collection of labels into a specific box or areas of an image. On the website, CCI details all the exam prep details, which includes an RCES exam overview, a knowledge list, and an examination matrix and task list. A key takeaway here is that the RCES exam is divided into 5 content categories. Take a look at these categories when preparing for the RCES exam. The 5 categories are A, conducting pre-procedural activities, B, conducting intra-procedural activities, C, performing diagnostic procedures, D, assisting with therapeutic procedures, and E, conducting post-procedural activities. The downloadable RCES exam overview document on the CCI website nicely outlines a knowledge list and sample questions, which is definitely worth your time reviewing in preparation. Whether you are looking to assess where you are at or entirely ready to take your exam, consider taking the RCES Self-Assessment Practice Exam offered by CCI, which you can access from their website. This self-assessment exam is an online self-assessment exam with 100 questions testing your knowledge of the 5 categories tested. This is a great way to gauge knowledge of exam content areas and determine areas of your strengths and weaknesses. This allows you to sample content areas according to the RCES exam matrix and the type of questions you can expect to see on the exam itself. Upon completion, you will immediately receive a scoring percentage of the correct responses in each category upon completion. As an RCES and CEPS credential holder myself, here is some advice I can give to anyone considering EP credentialing or certification. Number 1, the exam blueprint. Look at the exam matrix or blueprint, if you will. You can download the RCES examination overview document from the CCI website. The exam blueprint will serve as a roadmap of what concepts to study and master in preparation for your exam. Number 2, study resources. Gathering all the right resources for your study is vital in preparing to tackle the exam blueprint areas. As the spectrum of topics are broad, a series of additional study resources will need to be assessed depending on your current knowledge, experience, and skill level. Suppose you are looking for a set of focused tools for efficiency. In that case, the IBHRE offers the Cardiac Device Education and Self-Assessment course, otherwise referred to as a CDRMS course, as a device resource, and offers the EP Learning Experience online course as an EP resource. Number 3, mentorship. Take advantage of the IBHRE's mentorship program, which allows you access to IBHRE credentialed ambassadors whose mission is to prepare and educate non-credentialed learners. The ambassador group is composed of 40 plus CEPS or CCDS credentialed members worldwide. Alternatively, CHART certified coaches are privately available as an EP learning resource offered by CHART Healthcare Academy. Lastly, the self-assessment exam. A self-assessment exam is a great way to assess your performance and command of concepts before taking your credentialing exam. In preparation for a CCDS exam, the CDRMS program has a self-assessment component worthy of consideration. For the preparation of the RCES or CEPS credential, the RCES self-assessment exam offered by CCI is a great way to assess your readiness for EP credentialing. At this point, I want to take the time to personally thank you for your time and participation. Our hope is to provide additional information, guidance, resources for your professional growth and advancement in cardiac electrophysiology. For more information, check out the CCI and IBHRE website and social media channels. And last but not least, best of luck to all of you heading down the EP credentialing or certification road. You got this. Viva EP!